Good afternoon to all. I'm Jayashri Jagtap, working with Dr. D.Y. Patel Medical College, Pune City in India. First, I would like to thank you, organizer, who gave me a chance to present our work here. We are undertaking this study it is my part of my PhD, the study of psychological distress and drug adherence among people with drug sensitives and drug-resistant tuberculosis, Pune, which belongs to my PhD thesis. Here I'm presenting from one of the small component of this study, that is gender difference on psychological distress, drug adherence among persons with multidrug-resistant tuberculosis patients. As psychological and physical health both are fundamentally linked each others, it is the WHO's opinion that there is no health without mental health. As we see in recent era, there is a 27% global burden of TB in India, and the estimated 2.74 millions, that's the highest burden of MDR-TB cases. The multidrug resistant TB is caused by bacteria that are resistant to the first line drug isoniazid and rifampicin. The MDR-TB almost required 18 to 24 months treatment, which is more expensive with the toxic drugs. And the barrier, whatever the patients are seeking in their this healthcare MDR sometimes, which may also responsible for their treatment interruptions. Then the psychological barrier is one of these. The psychological distress and drug adherence. Next slide, please. The psychological distress and drug adherence, that the research shows that many of the factors that interplaying factor influencing treatment adherence to be like stigma, discrimination, drug side effects, also the psychological distress is. The study shows that almost 33% patients have a psychological distress symptoms, which affects their adherence. Even the study which done by Dr. Suryavanshi found the poor treatment outcomes in patients with MDR-TB registered for treatment in Maharashtra. There is only 30 to 40% cure rate found there, and almost 50% treatment defaulter rate is there. So the aim of this study is to study the gender differences on psychological distress and drug adherence among with the multidrug resistant tuberculosis patient while seeking care. For this study, we choose the area that is a population of Pune urban area and the PCMC area. The NTB covers the urban area through 17 TB units, each unit covering the population of 3 to 5 millions. So this was a cross-sectional study. Almost 124 participants. We did structured interviews along with the K10 psychological distress test. For measuring the drug adherence, we used, next slides, please. Measuring drug adherence, we used that medication adherence rating scale. We did patient in-depth interviews and also see the records. We included newly or previously diagnosed MDR-TB cases here, age above 18 years, who have sputum positive, gene exposed positive, or pulmonary or extrapulmonary cases, who have completed almost 3 to 5 months of anti-TB treatment, so that they have the experience with the treatment and all. The result is this, that almost the data shows that the larger number of cases belong to the young age group. It's almost 71.7%, the age group of 18 to 35 years. It can be seen in women cases are higher than the men. In this MDR patients, almost 58% women and 41.9% were men. Patients predominantly belongs to the nuclear and joint families. The unemployed and housewives and unskilled laborers were there. So on K10, we measure the psychological distress, which shows that on K10 around 87 point, next slide please, 87.5% of women reported high to very high psychological distress, and 82.6 men reported high distress issues. The data shows that the women have higher degree of psychological distress as compared to the men. And but it is the scenario we can see different on the drug adherence scales. On the next slides, there we can see in the case of drug adherence, 54% reported treatment interruptions. Women showed less number of treatment interruptions, 45.8, and the men showed it is for 65.3%. The data showed that women have higher degree of psychological distress as compared to men, in spite of having good, but still women have a good drug adherence. So for this study, we take the quantitative and qualitative both. Some of these narratives here that shows the problem of faced by those participants, which is mainly focused main areas that psychological problem we can see there: feeling of depressed, feeling of stressful, anxiety, and some somatic also. Some of the patient 8% participant reported the suicidal ideations also. There is a 26-year-old female who was detected with the MDR-TB. Even she tried to commit suicide. She felt frustrated with the medicine, and she started so many months. There was over, and also she has some family problems like quarrel with her husbands, and she was worried for her children also. She was worried that her own health also happened again. uh, all those things that have her mind going on, this thought was constantly going in her mind. So she had consumed kerosene twice, because she felt that she was frustrated for this long-term treatment and toxic drugs, all those things. One of the case is also there that the male who was detected with the MDR-TB, he had psychotic symptoms like hearing voice and hostile behavior. When we take a in-depth interview, that time he reported that due to some medications, he had that side effects like the cycloserine medicines. So for that, he got the referrals also, and the doctor changes his medicine. After that, after a few months, his symptoms also reduced. Another case is that who had a severe depression because he had 1.5-year-old baby, and he was extremely worried for his child health also. So the main point is that with this long-term treatment and toxic drugs, the MDR cases having those psychological issues, due to those psychological issues, sometimes they interrupted their treatment. Sometimes they also the treatment defaulter, so which is not good for their own health, even in the society, because it can be spread. It is a communicable disease. So if they are facing those issues, and due to those issues they are treatment they are giving up their treatment, so they can be uh, spread their the disease in the society also. So the conclusion is this: study found that the proportion of psychological distress among TB patients have a high, and it was influenced by a variety of factors. So the effective intervention to reduce the psychological distress in TB patient urgently need that to be developed, and greater attention should be given to the patient with risk factors. And thus the NTP staff, that is a national TB elimination program, care provider need to focus on mental health counseling and referral services as well, because almost there is a 68% participants who didn't get any referral for their problems. Thank you.
Thank you. Thanks a lot for